Hi, I'm Hannah Steeves, and this is my project. So, natural medicine has been used for a very long time throughout the course of humanity, and that kind of leads to the question of if we had found like such use in these things before we had access to science in the way we do now, what kind of things could we possibly be missing about these compounds? So, a very common natural medicine, especially in eastern Canada, was birch bark. Was often used as a poultice on wounds and steeped into teas and things like that. So, which is unsurprising considering what we've learned about it in the past few years. It has a lot of very beneficial um, properties, such as antibacterial, antifungal, um, it's anti-inflammatory, and especially the anti-cancer. So a lot of these effects can be contributed to the main um, kind of portion of what this extract tends to be, which is a compound called betulin. It's what tends to give bark of birches that kind of white color. So what we're going to be looking at here is, does treatment of betulin on A375 melanoma cells cause a downregulation of cyclooxygenase 2, which is COX2. So in melanoma cells, they're one of the cancers known that for producing like quite a lot of COX2. It helps them metastasize, and oftentimes it's kind of used as like a marker. So if someone's expressing like a lot of COX2 or a lot of things that are related to high COX2 expression, then oftentimes checking for melanomas and skin cancers is a good idea. We're also going to be looking at the ability of betulin to reduce reactive oxygen species within a controlled environment. Reactive oxygen species are often cited as something that causes inflammation, and if we're going off the course that COX2 is related to inflammatory response as a reactive oxygen species, then a decrease in reactive oxygen species should, in theory, decrease COX2 expression, in turn decreasing cancer metastasis. So for the methods, ran around and collected some bark. I did a siloxylate extraction using reagent alcohol. I took that extract and tested it on UPLC to ensure that it does in fact contain betulin. And on a DPPH assay, I ran the extract, both neat and 10x diluted, as well as a betulin standard curve. I did this to just kind of ensure that the extract and the betulin were both had antioxidant capacity, because if they didn't, then there was obviously something in the extract that wasn't in the betulin stock that was giving it its antioxidant capacity. So it was very difficult, I found, to properly isolate the betulin like just by itself from the extract. So that's kind of the course of action I went with. So I treated cells with just the stock and not the extract itself. 2 MTTs were done, 24-hour and a 48-hour treatment, ranging from 1 to 100 mg per ml. And PCR was also done using doses chosen from MTT. So the ones with kind of the least reduction in viability were chosen, both a low and a high dose. So what we found from this was that betulin itself doesn't really have a lot of oxygen scavenging ability, whereas the extract had quite a bit. So we can kind of infer from that the antioxidant effect of the extract is not due to the presence of betulin, but something else. There's a lot of options considering that it's an extract from a plant, and plants tend to contain a lot of different compounds and things like that. MTT results were quite good. Any sort of treatment gave a significant decrease in viability, which is quite nice doing an anti-cancer study. So, and comparing the two treatment times, 24 to the 48, there wasn't much difference. There's some significant stars up here, but they're odd. So, especially for the smaller dose, we'll probably chalk that up to pipetting error and just consider that the significance was irrational. It didn't really make much sense. As for PCR, no changes in gene expression, so it doesn't use the COX2 pathway. As for future directions, Um, there's obviously some sort of anti-cancer property to this compound. So using different methods of kind of detecting what it could possibly be, we've already ruled out the COX-2. So there's many, many other genes we can test for and many other assays we can do to try to figure out what exactly it is about betulin that gives it such a strong cancer-fighting property. Yeah, that's everything.